Welcome to the last session of the day for you diehards who are still standing or still sitting, as the case may be. My name is Amy Schultz. I am a university professor of diversity and social transformation and a professor in the Department of Health Behavior and Health Education, and I have the great pleasure of moderating the final panel today. And I'm really excited about this panel. We are going to be talking a little bit about where the rubber hits the road. How do we take anti-racist practice, anti-racist research, and translate it into practices, protocols, and interventions, right, to try to create change in a variety of places. We have an amazing group of panelists that you guys are going to have the pleasure of hearing from in just a moment. Each of them is going to present for 8 minutes or less, and we have our trusty timer out here who's going to make sure that we stay on track and that there is time for a moderated discussion and also for some of you to spend some time at your tables engaging in some of the work that we're going to be talking about today. So our topic is developing anti-racist practices, protocols, and interventions. The overarching goal of this session is to examine opportunities and tensions that arise for scholars and community partners, in many cases with whom they are working, as we attempt to implement anti-racism into our research practices and protocols, and as we design interventions and other actions that are intentional in their efforts to disrupt systemic or institutionalized racism. I'm really delighted to introduce you to our panelists today. I think you guys are, as I said, in for a real treat. Our first speaker is Lorena Chambers. Lorena is a postdoctoral research fellow in history and American culture. Johanna Mathieu is Associate Professor of Electrical Engineering and Computer Science and will be our second presenter. And our third presentation team is Lauren Oshman, Associate Professor of Family Medicine, and Paul Chandanabhumma, Assistant Professor of Family Medicine. And I'm going to turn over the podium momentarily with a reminder to the speakers to do what I didn't do, which is speak slowly for the benefit of our captioning service.
Okay, hello everyone. Thank you, Amy. Thank you, NCID, for putting this together. I'm going to hit, I guess, enter for the first slide.
Someone, I assume that's correct.
Do I do it? Okay. Fantastic. So again, hello everyone. My name is Lorena Chambers. See, let me adjust this. And as you may know, to us trained historians, context matters. So I like to begin these kinds of what I call safe spaces, these kinds of meetings, to explain that my last name, Chambers, is actually a Mexican name. Because immigration occurred to all parts of the world in the 19th century, a not-so-lost Scottish dude named McFarland and Chambers ended up in northern Mexico in the 1880s to work in the mining industry. So what can you do? Several generations later, my parents immigrated to the United States from Mexico, and I am a first-generation Chicana scholar. Soon after defending my dissertation at the height of the pandemic in 2020, I decided to check in on old friends in the academy since I had been away from the academy for, a minute. Within a short few weeks, I was shocked to learn how few other Chicanas had graduated with a doctorate in history in the previous 2 decades. I wrote a personal proposal to colleagues at the Smithsonian explaining that this was a crisis that needed to be addressed, especially because the demographic tsunami that is upon us is that 25% of all school-age children are Latino, taken on average across the country. But as we heard yesterday from our colleague Mara Osfeld, there is little appetite for Latino research in general, and even less so for researching subgroups. It tends to mess up the convenience of broad demographic categories, and checking off minimal number of boxes on forms and final reports is suddenly not so easy. And that's the issue with race and ethnicity in America. It's messy, and it's certainly not easy. So a year after creating a partnership with the Smithsonian's National Museum of American History, I started a postdoc here at my alma mater, the University of Michigan. I quickly received further support through an Ardrey grant from NCID and the library, and we also received a faculty grant from IRWIG, the Institute for the Research of Women and Gender. And both have been incredible partners, and we simply could not have advanced to where we are now had it not been for their expertise. The first 100, Chicanas Changing History, tells a story about a group of groundbreaking historians over the last 50 years. So of the 36.6 million Americans of Mexican descent in the United States, there are only 109 Chicanas to ever hold a doctorate in history. What this means in simple math is that 0.0000298% of us hold a doctorate in history. As an added data point, 13 of these 109 women are the only ones who are currently full professors across the United States and in the world. Imagine 13 full professors of history from a community of over 36 million individuals. Today, the full Latino community in the United States is that of 62 million people. Those of Mexican descent are not only the largest subgroup, but they're overwhelmingly the majority of Latinos in the United States, and mostly because of hundreds of years of colonialism and political entanglements. But we must ask, what does this mean for other Latino and Latina subgroups whose groups are even infinitely smaller than being Mexican and Mexican American? So this project the intention is twofold. One, the first, is to celebrate the work of these historians who have forever altered the historiographies of the U.S., whether it's in women's history, labor history, economic and political history. The second intention of the project is to build an archive for future researchers, and this is what I call the intervention. The first part of the collection is that of oral histories, which will be held here at the University of Michigan. The three-dimensional material artifacts are being added to the collection at the Smithsonian. By March, we will have recorded over 16 oral histories and produced 8 videos, which you can find on our website, chicanaschanginghistory.org. Just last week, I received a file of 30 pages dating from 1984 to 1989, documenting some of the first historians of this group when they were graduate students themselves. They were meeting at a UCLA conference to call attention to the paltry low number of Chicana historians and scholars in the academy. This shows how this story has been going on for quite a while. These documents, artifacts, and videos will grow our primary source collection of oral histories and material objects at 2 of the most, I think, most prestigious research institutions in the world. Over the last 2 years, we have hired and trained 12 interns, fellows, and contractors to assist on this project. They have pulled together public information such as graduation dates, dissertation titles, committee members, and graduating institutions of all of these 109 scholars. The team has collected over 2,000 data points about these historians, which in turn informs the ArcGIS maps that Ardrey has been instrumental in developing for the project. One example is this map. The Ardrey team developed 3 kinds of maps for the project. The first one was a degree-granting institutions, like the one you see on screen. 2, hiring institutions to show where these Chicana historians have been hired. And 3, a network and academic genealogy map to demonstrate the critical role of advisors and mentors among this group of mostly first-generation scholars. On this on-screen map, you can see that most of these historians have been trained in the Southwest. Not surprising, right? But also, only a handful have been trained in Ivy League schools. Perhaps also not surprising. The University of Michigan History Department has graduated 4 of us, 2 since 2020. This map brings up the critical question of resources versus commitment. On screen in the far western part of Texas, the University of Texas at El Paso has bestowed 8 doctorates in history, but so has Stanford University. 2 very diverse kinds of universities. Which brings to mind the old adage, where there's a will, there's a way. So I'd like to end with this one question. What does the future look like? Fundamentally, where does anti-racist research and policies lead us? What does the science and data tell us what we need to do? To fight systemic and historical racism, our work must answer the call to undo the very best way we can the androcentric, white supremacist legacy of the academy. President Santaono's email today, in his call for strategic planning, sums it up well. We must sharpen our impact. We must determine who we are, what we stand for, where we want to go, and ultimately, what we aspire to achieve at the great University of Michigan. Thank you.
Hello, everyone. My name is Johanna Mathieu. I'm in the College of Engineering. Specifically, I'm in the Department of Electrical Engineering and Computer Science. And I've struggled for a long time about how engineers can get involved in this space in a constructive way. And I think that you heard an excellent viewpoint on that from James Hawley yesterday. And so that was a really neat way of thinking about how engineers can engage. I'm going to tell you about an intervention that we're doing. It's a very interdisciplinary project. Oh, my slides are automatically advancing. That'll make it interesting. So a very interdisciplinary project. So how I came to this is connecting with very interdisciplinary team of researchers to try to make sure that we're making the impact that we want to make and working with communities in Detroit and building upon a very long partnership that some of my collaborators have established over years to not sort of impose our views and viewpoints in this community, but to work with the community to elicit their needs and their desires and try to help work with them through our research program. And so we have a couple of different projects that are ongoing simultaneously. We have an NSF Smart and Connected Communities project. NSF Smart and Connected Communities is a program that combines engineering expertise with multidisciplinary expertise, and so a lot of teams have folks that are sort of in the SBE, social behavior and economic side of NSF with engineering. And the goal there is really to work with communities to identify their research needs and to have them as partners at the table. And so we have a project with them that is a community-based participatory research project. We're working with partners, the Southwest Detroit Environmental Vision, Friends of Parkside, Jefferson East, and EcoWorks, which are all based in Detroit. My collaborators are in Institute for Social Research, so Karina Gronlund, Maria O'Neill is in School of Public Health, Shelley Miller in SEAS, which is the School for Environment and Sustainability, and Tony Reams, who we miss so much. Do you know Tony? All of you know Tony? Yeah, Tony was a professor in our School for Environment and Sustainability. His expertise is on energy justice. I should really say that this was his baby, these projects, and he's so amazing he got tapped by the Biden administration to go work for the Department of Energy, and his office is what has put out Justice 40 from DOE, Department of Energy. So he's amazing and he's still our inspiration, but unfortunately he can't work with us directly on this project even though he was the PI that brought it in. And then subsequently, we applied for a grant from the OVPR Anti-Racism Grant Competition to augment our project, and I'm going to tell you a little bit more about what we're doing, but we're partnering with an organization called Pecan Street. So my research, I should say in general, is to try to bring more renewable energy onto the grid. So that's what I actually do as my day job in engineering. But energy systems directly impact people's lives, and they impact people's lives in very different ways, and different communities have different access to the energy system. which requires us to think a lot about justice in energy. And so that's what the focus of these projects is. So in these projects, we're working with Detroit communities. We have 3 different communities we're working with in Detroit, villages at Parkside, Jefferson Chalmers neighborhood, and Southwest Detroit. And the project goal is to try to reduce energy burdens. So energy burdens are defined as the percent of your household income spent on energy. And we're hoping to do that in addition to potentially improving home comfort, health outcomes, and we're focused on low to moderate income households in Detroit neighborhoods. And because of the legacy of structural racism in society, these neighborhoods tend to intersect with different communities in Detroit that are organized also around race. So our project itself is, I'm not sure one would call it exactly anti-racism research, but I hope it's an anti-racism intervention that's directly trying to get at some of the issues associated with racism. As I'm sure many of you know, Detroit is one of the top 10 highest energy burden metros areas in the country. Low to moderate income households in Detroit spend 15 to 30% of their income on energy. So that's electricity and gas. 6% is considered affordable. So an overview of our NSF-funded project is we're trying to understand the role that energy case managers could play in reducing energy burdens and increasing home comfort. So energy case managers, you can think of these as like a social case manager. So somebody who's going to work directly with households to understand their needs and help them navigate through different programs and opportunities that might be available to them. So in this case, they specifically focus on energy. They have some expertise in energy, but mostly they're community members who people know and trust that are embedded in the community and have been trained to know how to access these different programs that people might qualify for. So they make an energy improvement plan working with the household. It's based on smart meter data. It's based on acquiring household and house characteristics through in-person visits. And most importantly, building a relationship of trust with the participants, because we find that there is a definite lack of trust, both of the researchers in this space, so working with our community partners, who then act as case managers because they're embedded in the community. But there's also a trust of the government and the utility companies. So going into people's house, and when you start talking about electricity, you mentioned DTE Energy, you get lots of opinions. And it's tricky. And we have to start off by saying, we are not DTE, but we want to talk to you about your electricity bill. And it's always a very tricky conversation, and we've had people in our recruitment workshops when we hand out some materials that say DT on them walk out because they don't want to work with them. So it's been an interesting thing to learn, and I think we underestimated when we started how difficult that would be. So I already got the 2-minute warning, so just to say here, our research questions are trying to understand how effective energy case managers are in getting people access to different programs, helping them switch electricity rates to ones that could reduce their bill, improving their house through weatherization or other technologies. We're talking a lot about decarbonization technologies now, switching people's heating from gas to electric, things like that, and people are very interested in getting solar panels and storage too. Unfortunately, there aren't many programs that support that right now in Michigan. From there, we're trying to understand households' basic electricity needs and also think about how we can design new electricity rates to better subsidize or even make free a certain portion of people's electricity so that basic needs are covered. And for the OVPR project that we were funded for, what we're doing is installing electricity submeters in people's houses. So let me tell you about submetering. So, I'm an engineer, so I like gadgets, right? So this is the gadget we're putting in people's houses. These are meters that attach to people's electrical panels. They measure individual circuits in the house, so they're measuring like the electricity consumption of your water heater separately from your air conditioner, separately from all the different appliances and things in your house at really high resolution of 1 second. It helps us see, is something broken and does it need to be replaced? Is that a potential for energy savings? How do people use electricity? And so forth. So it can help us create better energy improvement plans for the houses. The participants get to keep these things in their house as long as they want. They get access to their own data. Their data also gets anonymized, and we're dropping it in this data port so that all researchers will have access to it. And so the goal there is really to collect more data from LMI households so that they can be together with the data from the other households that Pecan Street, the organization I mentioned before, has worked with in the past. Most of the data that we have like this is usually from sort of upper middle class white neighborhoods, and we just have had a lack of knowledge into sort of how LMI communities consume electricity in this, with this level of detail. And so that's our project, and I'll stop there. Thank you.
Good afternoon. Paul and I are going to share the podium and tell you a little bit about our project. I just want to recognize that we represent a much bigger team. I'm Lorena Oshman. I'm an associate professor in the Department of Family Medicine.
Oh, and I'm Paul Chandanabhumma, but please just call me Paul. I'm assistant professor in family medicine.
We have Justine Wu in the audience, who's one of our other team members, and we represent the Anti-Racism and Health Equity Program, which really was an organically developed program in the Department of Family Medicine of our research scholars looking to create a forum to discuss anti-racism research in our department, which we felt was sorely needed. I think what's really important and special about this group is that we include not only scholars, we have one of our team members who works in one of our call centers, we have team members who are staff members on projects, so it really is a horizontally organized group and committee. What we're going to talk to you about today is a project that we've been working on together that exemplifies some of the ways that we're approaching research, and that is the ENDS project, which is equity in newborn drug screening. We did not put all of our community members on the first slide, as did so many of you, but I just want to acknowledge our expert consultants, who Paul will talk to you about, our participatory council of community advocates, and the trusted advisors in Ypsilanti who helped us tremendously with this project. So I'll give you a little bit of background, and essentially this project is regarding newborn drug testing, which we have found at Michigan Medicine to unduly burden Black families, which leads to disproportionate referrals to the CPS system, which then essentially leads to extensive surveillance and higher levels of criminalization and worse legal consequences for Black families with the same kind of concern, prenatal substance exposure, as for white families. So if you imagine you're in the hospital, you just had your baby, you're having a great day, but maybe you also are thinking, wow, it's really overwhelming. There are a lot of people coming in my room. A new pediatrician comes to talk to you who you haven't met before, and they ask you, I need to ask you some private questions. Ask everyone to leave the room, and they ask you, have you used drugs during your pregnancy? And you said, yes, I used cannabis from time to time. It was a conversation I had with a patient 2 weeks ago on labor and delivery. And then they explain to you that that is prenatal substance exposure considered a risk for child abuse or neglect, and they need to place a report to CPS. They perform a meconium drug test, a drug test for your baby, and if that drug test comes back positive, then it's considered as a reason for CPS to come to your house just to do an evaluation to make sure everything is safe and okay. And so what we noticed through our research is that the rates of those reports were higher for Black newborns and Black families, and we felt this was extremely important to evaluate and research.
So we'd like to focus on this presentation to reflect on how we honor the principles of anti-racism on the left side and translate it into the process of our research on the right side. What does it look like? So first we look to and honor the key principles of anti-racist practice, harm reduction, reproductive justice, structural competency, and many other frameworks, and look for opportunities to meaningfully, throughout consistent conversations and reflection, integrate into existing healthcare practice understandings and frameworks. Second, to honor the representation and inclusivity of BIPOC scholars, advocates, and community stakeholders. And Lauren will talk more about this in the panel discussion. We really engage with expert consultants of BIPOC scholars and trusted advisors and participatory council of community advocates to really center our findings through the lens of Black birthing parents and families, and to minimize interpretations that may further racial inequities. We also, we're learners. We seek to, as a collective, we search for, we seek out, we cite, and educate each other on BIPOC scholarship in the area. And finally, to reflect on collaboration and redistribution of knowledge and power, we really seek through this research process to share ownership and trusting trainees, research members, and everyone to take leads and contribute to quantitative and qualitative research process. And to put in my frame, I'm a mixed methods, community engaged researcher, that we practice in being patient and thoughtful with the process, and really honoring the process as its own.
So as you can imagine, honoring the process doesn't always work with deadlines, and we've really tried hard to make sure that we engage with anti-racist methods in our research. So one of the first things that we did looking at prior studies in this area, always comparing to a referent of white or college educated or a certain referent group. And what we sought to do in this study was to elevate this idea of focusing in on the people who are most affected by this problem, and so focusing in on Black families as the referent group for this practice. And I think while we really aimed to do that, we bumped up against word limits in the journals that we were submitting our paper to, and so this is really a challenge, I think, in looking at how to use our work and then publish it in an academic journal to make sure that we're able to get this work out to the largest audience possible.
So as in the medical school environment, which is very fast-paced, I think the most perhaps obvious but fundamental lesson is really taking a pause. So we're taking a pause here and just want to share some of the lessons learned. First, we really feel that anti-racism is about focus on equity of the process above and beyond the research for equity that we do. This means we need more time, money, and resources for community relationship building, fostering trust, and power sharing. Second is to navigate the tensions between the principles of and values of anti-racism and the academic expectations and institutional standards, some of which things like quantity over quality, sense of urgency, we recognize, as others have recognized, as being manifestations of white supremacy work culture. And third, we really want to build on the wisdom of community experts, and I should have put a capital E on the experts, and working within our parameters to elevate their perspectives and sustain their contributions for healthcare transformations.
Thank you. Is this on? Can you guys hear me? Okay. Thank you to our wonderful panelists who shared very diverse experiences of doing work that engages anti-racist practices, protocols, and interventions in very different spaces and in very different ways. And so we're really excited to now have a moment to have a conversation amongst the panelists. And I am going to ask them to begin with a question. You know, one of the themes that really came across through each of your presentations is, and that is fundamental to anti-racist or anti-oppressive research and practice, is the idea of disrupting the processes and structures that create and maintain power differentials, sometimes between individuals within the academy and sometimes between people who are situated within the academy and communities that we may care about or work with in some way. And I wanted to invite you all to just spend a little bit more time talking and thinking a little bit about what does it look like to disrupt power within institutions or between institutions that hold power and those who are not, who don't exist within those institutions. And I think, Lorena, you were going to start us off with this one, right? Happy to. Okay.
I can bring to the forefront our Collegiate Fellows Program, which is one of the best programs that the Academy has. It's at the University of Michigan. For those of you who may not know, it recruits diverse individuals. However, that creates an underclass of brand new assistant professors, mostly of color, of diverse backgrounds, with a power differential within their departments. And so we don't have all of the answers, but we can think about what that means. So we applaud ourselves. History department does very well on the Collegiate Fellows Program. We've recruited amazing individuals. But my understanding is there are income level where they can't afford to live in Ann Arbor. They have to commute 45 minutes away. The context of what older professors, mature and full tenured professors experience in Ann Arbor even just 20 years ago are very different. So I just give you a very specific example of what an incredibly positive, great program, but how we need to extend it and how to think about it more, right? That's just one example, those power differentials within the departments, and that's just here. And we have a lot of resources here. We are a really great institution. We have a lot of resources. One example is perhaps bringing in individuals to do manuscript reviews, right? Fly in individuals to actually go in and I'm going through that. And I failed to mention that this is my extracurricular project. I'm still writing a book and writing articles. And so everything here is just in my free time. And so what is it that we do to bring in folks to help actually mitigate the circumstances that we're in? Again, great programs, but I think we need to do more. Does that help?
Great. Yeah. Perfect. Thank you. And I want to open it to other members of the panel to share your own experiences, including tools or practices that you may have found helpful. And, just thinking about how do we know when power is shared, right? If that is an aspiration, how do we know it when we see it?
I think the thing that I would add about trying to work with community partners, we used quite a lot of the money, and again, thank you so much for the anti-racism grant that we were awarded from OVPR to do this work. We used a lot of that money to pay our expert consultants and our participatory council and our community advisors to work with us. What would I have liked to have seen for it not to have been so difficult to try to hire a community member to work on our research team, at which point getting access and a badge and a computer. I mean, the number of barriers that the university puts in place to really make that meaningful were very difficult, and we finally just ran out of time to be able to do that by the end of the grant cycle. I would love for our community members to be authors on our manuscript. Journals allow 8 authors, right, or a writing group, and so just thinking about the ways that our structures and processes get the results that they want, who has the power to change those, the journal editors, the other people in power, and what we can do as a group. And the reason that I think the anti-racism and health equity program has been so important is it gives us a forum to have power from ourselves, right? If I didn't have Justine and Paul in our group to talk to, I don't think I'd be doing any of this work. Even having a small group of like-minded individuals just, I think, sustains us.
Yeah, I agree. And I think since our project is based on community-based participatory research, there's been a history of making sure the partners are involved in both research conception and execution, and also making sure they're paid for all of their efforts and time. And so we also send a lot of our money to our partners directly. And then the NSF program that we're part of has a PI meeting every year, and they invite community partners. And this year we were super proud that we sent more community partners than university members. And we tried to be super engaged in this meeting to the point where we were, in a room of 200 scholars and community partners. We had our partners up there asking questions of NSF about how they can get more direct support from agencies like NSF that doesn't have to just always flow through the university. So that's how we've tried to do it, to just make our partners feel equal.
Great. Paul, did you want to add?
Does this go? Okay.
Yes.
Actually, I want to reflect on something else that maybe another lens to look at this. And I'm looking to Justine and the work that we do in our anti-racism and health equity program, the ARA program. One of our branches initiatives is to build partnerships with community partners. And I just want to reflect on what we could do in our capacity to build meaningful relationships with our community partners. So actually just a couple of weeks ago, or was it last week, we worked with a community partner to help them develop a grant proposal. It's not one that we could be funded upon, that we would get funded or because of like the roles and eligibility and so forth, but really, and I don't want to think about it as like a service or a sacrifice, but really these are meaningful steps that we can do to really elevate and amplify their contributions and perspectives, and maybe we can start to like dismantle sort of the structures that get in the way that advance their work.
Thank you, Paul. And I think, so many of these examples draw out examples that have been present throughout the last couple of days as the conversation has unfolded, that we're not talking about just changing practices of individual researchers or research teams. We really are talking about the institutional practices and policies that shape our work and that reflect what is valued by the university. And so doing anti-racist practice and interventions really does ask us to think about how do we change the values and how do we act on the values of this institution if we're committed to anti-racist work. And that's going to take us to our second question. So we had a little conversation before this panel, and one of the things that came up in that conversation was that I think everybody on this panel talked about their preparation as scholars and the ways that their educational pathways and educational trajectories may or may not have included preparation to do anti-racist research and practice. And so as a research institution, we have publicly committed to engaging in anti-racist research and practices and recognizing how deeply this institution is permeated and structured by white supremacist and colonizing ideologies and culture. It is in the air that we breathe, as the previous panel was so clearly expressed. So that shapes all of us as scholars, and it shapes all of us in terms of our training and the work that we try to do. So we wanted to spend just a minute and reflect on how that has shaped each of us as scholars and really ask the question, how can we as an institution better support faculty, trainees, students to more effectively engage in critical reflection about what it means to do anti-research practice, anti-racist research and practice, and really to engage in this work more effectively. So I'm going to turn it to the panel. I think, Paul, are you going to kick us off here?
So we really feel that the end study has been really a rewarding and exemplary example or project of how to write high quality research papers or products and acknowledging there are other forms of community public dissemination, but really we seek to trust each other to take on a role, no matter how big or small, no matter what stages of trainings. We let residents, statistical leads, undergraduate students take lead on different parts, and giving the space to junior writers and senior writers to really engage in diving in, and really go through this process and take the time to resolve disagreements and conflicts. And then it may be a longer process before we actually get there, but I think we have had a couple of examples where we got there. And so it really is a reflection to me of how equity can be an outcome of the process. And in this case, in terms of shared writing across disciplines, stages of training, lived experiences, and so forth. And that's hopefully something that I can take to my other projects and endeavors.
Yeah, I think the thing that's on my mind, I think that you both alluded to is making the work your work. So this idea that, Paul and I were up until 9 or 10 last night writing this paper with one of our residents to turn in today, and when does the work get to be my day job? And I'm not quite sure when that is. I feel a tension as a family physician. I don't consider myself to be an anti-racist scholar, and this idea of family medicine as counterculture, as bringing medicine back to people where they are and taking it out of the ivory tower, reducing specialization and creating a family home for our patients. I see our work as elevating the voices of the people that we work with. And there's an inherent tension in that, in being in the medical school and being in a very highly regarded medical school where family medicine, our discipline is often kind of like not at the top of the tower. And so I think, in some ways, finding ways to bring this to the forefront and making sure that this work is valued in the way that we're tenured and promoted. I'm a clinical faculty. I don't get promoted. I don't get tenured, rather. I can get promoted eventually. But a lot of these pieces, I think, for someone like me who went to a community residency program and training and doesn't have the kind of PhD research background, it's working with other people in our institution who also value this work that makes it sustainable.
Johanna, did you want to add?
Yeah, I mean, in terms of training, there's been some things said here about the training that engineers get, but you don't usually think of engineers getting training in this sort of space, right? A lot of us piece it together through different opportunities we have had or different things we pursue. But then training students, also you have to encourage them to look outside of their normal program in academia to find these opportunities so that they can engage with communities. But I have found that the most important thing for me has been to make really strong partnerships with collaborators in different fields who can bring different knowledge sets so that we can converge on research that's mutually interesting to us, and it's also true with community partners. One of my favorite things to do when I go to a conference, especially if it's interdisciplinary conference, is gather a bunch of people and just if I'm having lunch with people, just try to brainstorm what kind of, if we had to write a grant proposal today, what would we do? And sometimes you're talking to people very different than yourself, and it's kind of fun to think that through. But then at that point, if you decide to pursue that, it can take years before you speak the same language and can actually work on research together. And so I don't know what the lesson learned is, but it's not an easy path to come from a discipline where this type of work isn't inherent, and then maybe it's not inherent in any of your disciplines. I don't know if I'm assuming things I shouldn't assume, but to move towards doing work that's impactful and finding the right folks to do that with is really hard.
So in my day job, I actually studied the cultural diplomacy between the US and Mexico in the 1890s, and how that cultural diplomacy created performances of Mexican and ethnic Mexican musicians in the US. My goal throughout all of my work is to decrease the erasure of these stories that either have not come into our history for the first time, but also, ironically, is the history of these very elite historians, right? These women that have accomplished all. And I think that speaks also to invisible labor, right? Is it a labor of love, but is it also invisible labor? And so these concepts that came up yesterday as well, and how is it that we accomplish all of this and move forward, frankly. So my focus is, again, trying to decrease the erasure in a lot of different ways, but that is the goal of creating this archive so that when I'm gone, whether physically or from Ann Arbor, we eventually will have those archives so that others can continue that work. So, yeah.
Thank you all, and I appreciate that you all talk about the labor of love and the hidden labor. It reminds me of I'm going to date myself here, but a book by Barbara Ehrenreich called The Second Shift. It's the work that we do after the day job is over with, and it is because everyone in this room is committed to the work. So I'm going to, now we're going to turn to the tabletop conversations, and you guys have the 2 questions on your tables that have been the guiding questions for your conversations throughout yesterday and today. We're going to invite you to add a question to the list that you have been thinking about, and what we'd really like to invite you to do is to continue to consider this question of how we as an institution committed to anti-racist practice, training, and intervention might better support faculty and students who are interested in, committed to conducting anti-racist work, including its translation into practice or interventions that disrupt racist ideologies and institutionalized practices. So we have till 3:30, about 15 minutes for you guys to have that conversation, and then we'll come back and hear from some of you what you shared at your tables. Yes, okay. All right, guys, I think we're going to come back together. It's great to see that people are having such great conversations at your tables. I want to make sure we stay on time because it's the end of a long day and we want to get out of here at 4 o'clock and enjoy some of that sunshine out there that I'm seeing through the window. So as we have done the last couple of tabletop conversations, we're just going to invite anyone who might like to share a few words about the conversation at your table to raise your hand, and I think someone will come around with a mic and find you. So anyone have conversations at your tables that you would like to share with the larger group about any of the 3 questions or other things?
Hi, Justine Wu, Family Medicine, Michigan Medicine. It wasn't necessarily answering any of your questions, Amy. I'm sorry. It was more just getting to know each other a little bit better and talking about, I'm kind of surprised it didn't come up at all, but intersectionality and our role as women and as immigrants, as well as as an immigrant just 4 months ago. I'm the daughter of immigrants, and how we didn't touch on it much, and I was kind of surprised, but that was really what was on our mind as far as, I think, part of the code switching issue, but also just our roles here at the university.
Yeah, thank you for lifting that up, Justine. Others, conversations that you would like to just share out? I see fingers pointing over here. Finger pointing.
And thank you all for your presentations. What resonated with us first was Dr. Mathieu's research in Detroit on the energy cost, and we're kind of stuck on affordable energy being at about 6% of income, but in certain communities it's 15 to 30%. So we were wondering if you could maybe talk a bit about that disparity and what that looks like in those communities outside of Detroit.
So there's a couple different components of that. One is households that are old and large, consume a lot of energy. You should weatherize your household if you can to make it more efficient, right? But if a household hasn't been weatherized in a long time, then that's just insulating it and otherwise improving its external structure. It tends to consume a lot more energy than it should for its size, right? So that increases costs, and then energy burden, which is the statistics that were mentioned, is taking your energy cost and dividing it by your income. And so the income piece is a huge piece as well. Just looking at those neighborhoods and average incomes anywhere between $11,000 and $40,000 a year. So those two things both are what's interacting. But many major cities in the US have similar statistics. Detroit is in the top 10, but it's in the top 10, so there's at least 10 others that are very similar. And there are also rural areas in the US that also have very, very high energy burdens as well. And some of that maps to the Justice 40 initiative has created. Are you familiar with Justice 40? So Justice 40 is a program that came from the US Department of Energy, I believe, and it says that 40% of the money that's basically flowing into communities for energy and infrastructure related work has to impact underserved communities. So that it's 40 is the 40%, so it has to go to these certain communities. And so they actually put together a map that reflects which communities count as Justice 40, and you can use that map to look at energy burdens. So it's much more about energy burdens and income than it is about race, but because they couldn't use racial identifiers, as far as I understand it, when they created this map. But people have gone and looked and mapped this, and there's a very high correlation, of course, with income and race in certain communities. And so it's sort of a way to help us access funds that specifically can benefit these communities. So it's a very interesting map. I wish I could show you now and that give a better answer to your question about what about other communities as well, but there are many of them.
Thank you, Johanna. Yes.
Hi, Geoffrey Thün, from speaking on behalf of our table. We were talking, I think, trying to address the question you raised, Amy, about the nature of infrastructural conditions at the university that impede pursuit of anti-racism research. Reflecting on a couple of things, both the work of this panel and work presented previously in the symposium, we're hearing about people doing amazing work engaged in community and engaged with community, high impact work aiming to affect change. And when we look and scan the horizon for where the primary sources of funding to support that work comes from, is primarily from the nonprofit sector, or you think of it as foundation sector that Donald Artigue was presenting to us today. This is also the type of funding that is most likely to support many BIPOC faculty working in this space. Many of these organizations are focused specifically on underserved community and specifically on the idea of impact, which is very different than the work pursued by basic science, let's say. Now, one of the problems is most of these foundations don't provide indirect costs. National levels, 56.5%, and we have a provost tax of 21.4% on every dollar expended at the university. The number one impediment to faculty pursuing this type of work engaged with community and supported by nonprofit sector is the fiscal pressure down at a unit level and across the university that's created by our fiscal model. That's a very significant thing, and it's a structural infrastructure that impedes this space from going ahead. Then we heard the conversation from the deans today, and this is another big issue, the cultural infrastructure. Mentors advising faculty in many cases and in many units, that pursuing this type of support for impact-oriented, community-engaged work shouldn't be their priority to make their mark in a discipline that has certain standards and that prefers and recognizes certain forms of dissemination. So we have a very clear structural infrastructure and a very clear cultural infrastructure. Those are two examples that need to be addressed, reconfigured, and removed as barriers to pursue this work. And I want to just thank the deans, particularly Dean Curzon, who said, we own this, we can change this, and we should be recognizing what are the things within our local capacity, but also within our roles within an institutional structure to be able to kind of dismantle those part of ourselves that are preventing faculty from pursuing this work and creating impact. And it turns out we have President Ono has announced a strategic vision. If we think about what ingredients we might want to prioritize in that strategic vision, can we also rethink the nature of what the University of Michigan should stand for and undertake, what a public research university should be doing in the world? So I don't know, I just want to raise that as a thing. Apparently there's a moment where we're going to rethink the strategic vision, and might we target some of the systematic structures that exist within our own institution that are preventing us from becoming what we want to be as part of that process.
I appreciate that because of the structures, the 21% overhead. As a former government contractor, I totally understand that. One thing I didn't mention, my political consulting firm, this is what I've done for the previous 20 years, we actually kicked in $25,000 to kickstart this project in services and in kind, because the Smithsonian was not going to fund anything 100%, right? So what is it I had to put my money where my mouth was, right, to be able to launch this program. And I fully understand that that is a very prescriptive position and a very privileged position that many others never would have access to that. And so I'm glad you brought that up, because it wasn't funded 100% by Smithsonian or others, but it was the engine that got it started. So thank you for bringing that up.
Thank you, and I really appreciate that you began to do the work of anti-racist practice, which is interrogating the systems and the policies and the processes that reproduce white supremacy and racism within our institutions, and brought that back into the core of the conversation. I also appreciate that you talked about structural, institutional, and cultural, and going back to an earlier presentation on this panel, recognizing that those are very closely interconnected, right? That it is a false dichotomy to separate them, but we need to understand how they operate together. Any last comments? Any other panel or tabletop conversations that you'd like to share out? Justine has, yeah.
Dr. Thün, I just want to respond to your call there. And I'm just wondering if we could leverage the time that we've had in the last 48 hours to get a jump on what is going to, what's going to happen when we start the strategic initiative, and what can, and most importantly, what may not happen. And I will express as, we had 4 wonderful deans here today, and no one's surprised that they showed up. I expected public health, social work, education. The medical school is not here. And I think that's a big problem. And I've spoken to many people about it. We have the most dollars, we have the most number of faculty, and if they're not here, I don't see how this is going to work. And I also see, if we don't have the regent's ear, how any of this is going to work. And I think President Ono, I think we have a lot of hope in him, but I also worry. He's not the ultimate decision maker, right? He can get fired. We all know that. And I want to be able to support this new president in that way, to do the right thing, because I do think that's why we're excited for him to be here. But I just wonder about the people who were not here today. And can we as a collective come up with some sort of statement to act upon everything we've spoken about today and jump on this as the train's moving already, right? So I just want to reflect back on your call there, that I think we have some power in the room, at least across a handful of colleges and many faculty.
Thank you, Justine. All right, we are going to close. This is the moment in the session where the moderator is asked to give our closing comments, but I am going to pass that role to the panelists and invite the members of the panel to make any closing comments they would like to make, generated by the conversation that we've had here this afternoon. So we don't have to go in order, but
everyone's looking at us. I wrote to Paul, my closing comment is, how do we do no harm? And I think that both means extractive work, incomplete work that doesn't center the community. And as we publish our work, just thinking about this idea of how does the system create the results that it's created to get. Our first journal that we're submitting to, asking us to remove the information about the participatory council and the community engaged nature of our work because it's too long. Our second journal asking us to use an equity checklist and make sure that we're demonstrating how our work is community focused. So I have a lot of hope that we can tell these stories in ways that really do advance racial equity and anti-racism.
Thank you. I will close. I'm an optimist, so I'd like to close with a personal story, a personal side. So in my graduate school, as Lorena called it, extracurricular, but my favorite project was to initiate a conversation about decolonization in public health. And it was really driven by my guiding question of what does it mean to decolonize public health? And so I want to borrow that guiding questions and then apply it in this context, in the context of a study of what does an anti-racist healthcare system look like? What happens when you open the door? What do you see? What do you hear? What do you sense? And what can we do in partnership with those whose perspectives and wisdom should be elevated to make us closer to that vision? And I also think about where we are as an institute of higher education. What can I tell my trainees, mentees, students, and others how to do meaningful anti-racist research and scholarship even better than I do? What kind of wisdom do I have to pass on to them? So I'll end with that. Thank you.
Thank you, Paul. Do you want to go first? Okay.
So Amy had talked about disrupting power, and my colleagues had talked about sharing power. And those are anathema to human nature, but I believe that is the premise and the basis of anti-racist work and diversity, equity, and inclusion. I will leave you with something I learned being a kid from Southern California. I'd gone to UCLA as an undergrad. I showed up, never had seen snow fall before when I was here in the late 90s on my first stint at U of M. And I learned from colleagues from the South. And it's been something that's driven me as I think through things. But there is an adage that says, if you always do what you've always done, you're going to get what you've always gotten. And so we need to disrupt that. And I also believe in Michigan football, and so thank you for those who stay shall be champions. So thank you all for being here to the very end.
I don't think I can follow that one very effectively. I just want to say that I've learned a lot in the last 2 days, and also from all of you, and I really appreciate you coming and sharing. Thank you for also inviting me as somebody who's sort of non-traditional in this space. But if you want to sit at a table and brainstorm a project together, regardless of what discipline you're in, I'd be more than happy to do it. In fact, I'd be super excited to find some new collaborators. So I'll just leave it at that.
All right, thank you. And please join me in thanking our fabulous panel one more time before we close. Thank you, guys. And I want to thank the session organizers for the opportunity to have such a wonderful set of conversations. We were talking about how rare it is to get together across disciplines and really share our work and share our thinking, and it's really been a fabulous, fabulous day. I believe my job now is to turn it over to the closing speakers, who are on their way to the podium right. Trachette Jackson and Jeff Thün. So we're supposed to stay here.
Well, everyone, we did it. We made it to the end of day 2 of the faculty. Oh, yeah. Let's all applaud. Day 2 is wrapping up on the Faculty Symposium for Anti-Racism Research and Scholarship. Again, I'm Trachette Jackson. I'm the Assistant Vice President for Research DEI Initiatives, here with my colleague, Jeff Thün, who is the Associate Vice President for Research for the Social Sciences. And on behalf of the Office of the Vice President for Research, I'd like to give a big and wholehearted thank you to the Planning Committee and all of the event staff that worked tirelessly to put on this event. They attended to all of the details and moving parts so that we could come together, listen and learn and engage, and I hope that's what you felt happened over the last 2 days. I also want to thank all of the presenters who shared their important work. Over these last few days, we have heard from scholars who are not only producing new knowledge, but are actively working to advance racial equity and justice in partnership with historically and systematically oppressed communities, and that's so, so important. I hope we have achieved the goals of the symposium and that you walk away from here today with a better understanding of what anti-racism research looks like, that you have a better understanding of who does that type of work, and that you feel encouraged and excited about connecting with each other. I'm personally leaving this meeting with a new understanding of what we're fighting against and what we're working toward. I'm going to continue to find ways for OVPR, the Office of the Vice President for Research, to be a part of the action, right? Because the goals of this symposium really align with our overarching mission. As I also mentioned this morning, I'm committed to finding ways to extend this work beyond this moment in time. And I think I just heard what I took to be a call to action for this group. To really have a voice in the strategic visioning of our university. And I hope we can collectively be that voice and that, we can make a change in those directions. I am looking forward to continuing to engage with this community in support of our common goal of amplifying anti-racism research and scholarship and creative practice on the campus and disrupting structures and cultures that impede it. So I'm going to turn things over to Jeff.
Thanks, Tracy. We also hope that you'll take with you some of the questions that were raised and discussed across the moderated sessions and the tabletop conversations. Take those questions back to your classrooms, your research labs, and personal spaces. We hope that the conversation and questions from this faculty symposium form part of an ongoing campus-wide dialogue. I mean, for me, one of the things that is really exciting about listening and learning from the folks who were presenting over the last couple of days is the diversity of perspectives and disciplinary efforts that are working in very different ways in this subject space, both to illuminate and to dismantle. And that's very profound, very powerful to me. Although the faculty symposium is over, the work continues and the conversations and dialogue continue. So one exciting thing that I'm really happy to be able to share with you today is a reaffirmation of OVPR's commitment to supporting anti-racism research. So we will be continuing the funding program that supported some of the work that we saw today with another $1 million over the next 2 years. And the deadline for submissions will be June 1st. So that there's plenty of time to put something together. Don't worry, it's not due in early March. The other thing we're going to do in response to one of the comments that was made by a colleague here was extend the funding period to a 15-month cycle so that particularly for disciplinary areas that really rely on summer, a full summer to line up grad students to work on something, that would be possible within, say, the later period of a project. And we're open, the door's always open. Please reach out if you have perspectives on other ways we can improve the programs. So I hope that's exciting news to this community. As we close out, there's a few logistical issues that the team has asked me to also mention. One is feedback. You know, was this a great symposium? Was it? Yeah, please, yes. How could we make it better? How could we make it better? There's a QR code on the table and a little form you can offer feedback, or at the registration tables there's pieces of paper if you don't want to fill out yet another Google form. But we're interested to hear, or even just mention to people what you think we could do to make it better, or what you thought was great. We're interested in shaping further conversations and love to get the feedback. Also, with respect to the videos that are being produced and other forms of recording that have taken place, we'll communicate back out to the registered people who have attended the conference to let you know when those are available online. And this evening, we just encourage you. We've got the ballroom reserved until 5 o'clock, so if there's folks that are keen to continue conversations, feel free to hang out and in community here. And then thank you very much again to everyone who helped to put this together and everyone who's joined us for the conversations and contributed their work and thinking. Thank you.